Today, my topic is about the prevalence of anxiety or depression and its associated factors among people living with HIV in Guangzhou during the COVID-19 outbreak. This is the main content. COVID-19 has become the public health event globally since 2020. In Guangzhou, as of September 20th, the totally 349 domestic confirmed cases were reported. The peak number 10 is during the February. Guangdong province was the first one launching the first level response to COVID-19 on January 23rd. Fortunately, the COVID-19 epidemic has been quickly controlled in China by the Chinese efforts and comprehensive measures, including the traffic control, community quarantine, and the screening and the testing for all in need. But for the HIV infected patients, they have to receive lifelong treatment. So they face many the problems, for example, the delay or failed access to drugs, the absence of monitoring, and the mental attack during the COVID-19 outbreak. According to the report from WHO and the US, during the COVID-19 epidemic, 6 months interruption of ART will cause more than 500,000 deaths from AIDS-related disease, and the mortality will fall back to the 2008. It's well known, HIV-infected patients may have more physical, psychological, and social problems, among which anxiety or depression is one of the most common psychological symptoms. When facing both major public health events, HIV-infected patients may have an increased instance of anxiety or depression. This study is going to investigate the prevalence of anxiety or depression among HIV-infected ART-treated patients and its influences. We are going to provide with evidence for exploring approaches to reduce the incidence of anxiety or depression among them during emergent public health events. In this study, we recruited 550 HIV-infected ART-treated patients from the AIDS clinic of Guangzhou AIDS People's Hospital from February 10th to 28th, 2020 by convenience sampling. This is the inclusion criterion and the exclusion criterion. And we perform the survey by anonymous, and we have a uniform, trained, and qualified investigators. The patients were given questionnaire surveys by face-to-face interview or one-on-one interview via WeChat. The scale used in this study was the hospital anxiety and depression scale. And the Morisky medication comprised questionnaire contains a total of 8 items, and the simplified coping style questionnaire consists of 20 items. In this study, we created 550 documents with 515 valid ones. Of the 515 patients, 89% of them were male, and their median age was 33 years old. Totally, the incidence of anxiety or depression was 32.8%, anxiety was 21.7%, and depression was 23.3%. By the univariate analysis, we can see some potential influencing factors, including the residence, the occupation, the educational level, and the access to drugs and the treatment regimen. The quarantine site, the COVID-19 infected cases in community varies about self or family COVID-19 infection. The duration of home quarantine, the storage of epidemic prevention supplies, the medication compliance, and the positive coping style. By further analysis of multivariate analysis, we can see that patients with bachelor or above degree and highly positive coping style to COVID-19 could be protective factors. The usage of the second line or self-paid drugs, insufficient storage of supplies preventing COVID-19 epidemic, the poor medication compliance could be risky factors to anxiety or depression. From this study, we can see that the incidence of anxiety or depression among people with HIV was high during the COVID-19 outbreak, and the influencing factors were various. We should pay more attention to patients with poor medication compliance, a lower education, and taking the second line or self-paid drugs. We can take some approaches to improve the medication compliance by ensuring the access to drugs, providing with more psychological care, and we can store the epidemic prevention supplies in advance, and we can take some positive coping style. For example, the clinic keeping open, mailing medicines to patients who could not go to the clinic, and we can give the patients timely notification, and we can give the patients more personal case management. So these some pictures during the COVID-19 endemic. We mail medicines to the patients, and every day we have to mail more than for 100 patients. So in the future, we can develop internet medical platform, online hospital, and more case management, there's some drug dispensing. So the inclusion, people living with HIV were at high risk of anxiety or depression during the COVID-19, and then we can take more attention to the people for those patients who need the care. And we can take some positive coping approaches to make them reduce the anxiety or depression. So thank you for all your attention. Yeah, this is some pictures of the outpatient hall of our clinic and the family member of our clinic. That's all.